Republican senators are going home to their states. They'll be meeting with constituents at picnics and barbecues and the like. Democratic senators will be as well. What's their message going to be to their constituents?
Well, I hope those Republican senators will meet with their constituents, because what we saw in the House was that they were actually avoiding their constituents. And they're avoiding their constituents because their constituents are hopping mad. There are people who have family members suffering from opioid addiction, people who have a 14-year-old on the autism spectrum, people who have a senior citizen who has $3,000 a year in prescription drug benefits. And all of this is at risk because of this mean-spirited bill. The House bill was mean, the Senate bill was meaner. So we're going to keep talking about the fact that this bill is going to hurt millions of people, plain and simple.
Okay, so you clearly want to engage with your supporters. Is there any way that you can engage with those who've crafted this bill to try and make something a little more palatable that could actually pass? Because, of course, you don't like what's on the table at the moment, and many of your supporters won't like it either. But what about engaging with the other side?
Well, listen, we would love to engage, and when the Affordable Care Act was debated in the Senate in 2009, 2010, there were 100 hearings. 143 amendments made it into the final bill that were Republican amendments. It was a two-way street. This has been done in secret, and they did it in secret because this is a terrible bill, and they didn't want people to see the light of day on this bill. And so they haven't shown any interest in negotiating. We can always improve the Affordable Care Act. President Obama said that. I've said that many times, but there's no will to. You have to. They want to repeal. That's what they've been saying all along. And what repeal means is that 22 million Americans will lose their health care. Countless others will be in danger because they have diabetes or some other pre-existing condition. Step one needs to be stop the effort to repeal. Let's figure out how we can expand health care. Let's figure out how we can fix what needs improvement. I'd be happy to do that, but there's been absolutely no sign of that from the other side.